In the complete hemodialysis series, today we will see regarding the techniques involved in the cannulation of AVF, atriovenous fistula, artery connecting to the vein. Then there is a outflow segment, that is the cannulating segment, ideally 4 to 6 centimeter. Technically or theoretically, if we see, there are two ways to cannulate it. One is called rope ladder technique, another one is called buttonhole technique. The names appear fancy, it is simple. Let us take this as a AV fistula outflow segment. In the background, we will try to provide a video of cannulating the segment itself. But for the resident or the dialysis technologist, assume this as a AV fistula, the cannulating segment. If every time we are cannulating at a different site, that is called as rope ladder technique. The name is nothing but multiple steps of a rope ladder. You might have seen the description is same, just multiple times every dialysis different site you are pricking. That is the rope ladder technique. If in the same dialysis in the AV fistula, multiple session, only one site is being used, only single site, it's called as buttonhole technique. The description is simple, multiple site rope ladder, single site, it's called buttonhole. Most of the time the decision factor will be on the length of the fistula segment. If the length of the cannulating segment itself is low, very difficult, just you have to cannulate, you can't see which technique you are going to use. This rope ladder technique, if we take, there are few advantages. What is the advantage? The chance of infection is less. Every time you are using a new site, so the chances of aneurysm, that is bulging out of the vessel, is less. Disadvantage is also there. Disadvantage is cosmetically it will look poor because multiple needle points, it will look or appear poor. Every time we have to use a sharp needle because blunt needle might not work. And one more point is related to that entire segment. Every time you are using the new point, the expertise, the dialysis technologist or the nursing staff who is doing that, they have to be expertise in doing that. That is one drawback, and disadvantage is cosmetic appearance. This is all regarding the rope ladder. Now let us take the another one, buttonhole technique. Same site we are pricking multiple times. What will happen? The track will form surrounding little bit collagen. The track will form. Major advantages, the pain will be less. Pain will be there but less than the rope ladder technique. Second one, easy to do. Since the track is already formed, even this is the preferred technique for home hemodialysis. In the home, if some patients are doing hemodialysis, as in some foreign country, buttonhole technique, just take the needle, put it in the same track which is already established by the expert dialysis technologists or the nursing staff. And advantage is easy to do. And one more thing is the track is already formed, so blunt needle can be used. No need for the sharp needle. Blunt needle, so less pain. These are the advantages. But it is also with disadvantage. What is the disadvantage? Since a particular site is pricked multiple times, aneurysm can form. It will bulge out. Aneurysm is very, very common in buttonhole technique. Another one is infection. The track itself acts as a media for growth. Staphylococcal growth is very, very common in that particular area, site. So buttonhole technique, infection and aneurysm are the side effects, or we can say demerits. Whereas rope ladder, this disadvantage is not there. So in summary, when to prefer which technique depends on the cannula segment, depends on the patient profile and the expertise. Most of the time rope ladder being used. In some centers they prefer buttonhole technique. Each have its own advantage and disadvantage. One MCQ related to the entrance for the resident is home hemodialysis, which technique to prefer? It is buttonhole technique. So this is all regarding techniques related to the AV fistula cannulation. Bye bye. In the next video we will see the other technique related to AV graft cannulation. Okay.